I have decided to come on a little bit early in an effort to allow some of you to get on and take a look at what I'm talking about today. Good afternoon, this is Neil Palache with the Wealth Creator Company for Women. For those of you who don't know, I am, and I call myself, a certified concierge women's money coach, working with divorced and widowed women who are going through, thinking about going through, or have gone through a divorce, or who have unfortunately become a widow. I have run classes and seminars, mastermind groups, forums, individual and group coaching, etc., and teach and advise and work with you to make sure that you have your financial crap in order. Yes, that's what it's all about. Very difficult, traumatic sometimes, but certainly very stressful situation to go through, life scenarios to go through, and I want to make sure that you have everything that you need and want when you're in those situations. So today I am going to chat with you a little bit about health insurance. It's that time of year, and quite frankly, although I know that we're in a political season, it doesn't really matter whether you are a Democrat or a Republican. I think that everybody can at least agree, for the most part, that our health insurance system is a bloody mess. I'm not saying that it was any better before, I'm just saying that it is a bloody mess now. And as a result, we have, seems, many people who are not happy because they are paying more and receiving less, for the most part. I have spoken to a few people who are getting exactly what they need, but that seems to be a rarity. I don't know what the answer is, but I will tell you that at this time of the year, you are going to be making choices as to what it is that you want to do, or you're about to be making choices as to what it is that you want to be doing. For those of you who are in Medicare, for those of you who have just regular health insurance, and for those of you who have group plans at work, you're going to be making various choices. And I know that you know this, but or at least if you don't, you're about to find out that you've got PPOs, HMOs, EPOs, 3POs. No, wait a minute. That's Star Wars. I get mixed up with that stuff sometimes. But in all seriousness, PPOs, HMOs, and EPOs, and they are sometimes not entirely clear, although it seems to be clear that an HMO, without question, a health maintenance organization, is easy to classify because most people know what Kaiser is, although not all HMOs are Kaiser, but everybody knows what Kaiser is, which is a place where you can go and receive all of your medical services essentially in one location. Don't always get the choice of doctors and so forth that you might prefer, but nevertheless, it is a place that you can go and receive all of your medical attention in one location, specialists and so on and so forth. And that's the idea of an HMO. When you move up to an EPO or a PPO, then of course you have more choices. As you move up to the PPO, you have even more choices of doctors. You will also have choices of deductibles. That really hasn't changed too much in terms of how a deductible works. The deductibles are in most cases significantly higher than they used to be, in the thousands in general rather than in the hundreds. So how do we deal with that? How do you deal with the fact that you may be going to the doctor, your kids may be going to the doctor, and yet you have a deductible, and therefore you're going to be paying much of your medical costs out of pocket, at least initially, if not for the entire year if you never reach that deductible. And you're going to have co-pays, and a co-pay is that $5, $10, $20, $30 that you'll pay for medicines or doctor's visits, that again are those out-of-pocket costs, those costs not covered by medical insurance. One of the things that is important to at least look at, and I know that it doesn't apply to every situation, but I see that people aren't looking at it. Agents are not showing them, or it's just kind of going by them, and they're not realizing what it is they've just been shown. and that is HSAs, health savings accounts. Health savings accounts are a lifesaver with the current status of our health insurance system. Health savings accounts means that you can put away literally thousands of dollars a year on a tax-deductible basis and use that money at a later time to pay for medical expenses. Crucial. So if you have a deductible of $1,000, $2,000, $3,000, $4,000 and more, and you can put away, let's say, $3,000 or $4,000, depending on whether you're single or a family, married, not married, you can then use that money to pay for medical expenses. Or, unlike the FSA, the flexible savings account, which some of you will have available at your place of work, and I'll get to that in a minute, the HSA allows you to roll over the money that you don't use from year to year, every year, indefinitely. So you have the ability to put that $3,000 in there, let's just say, deduct it from your taxes. You will not pay taxes on that money, and you will then be able to roll that from year to year to year. Theoretically, if you never used any of that money, 10 or 15 years down the road, you could have $10, $20, $30, $40,000 packed away in your HSA. You've deducted all of that money from your income, not paid tax on that money, and then at some future point decide that you're going to use it for medical. It could be the doctor or the hospital. It could be long-term care needs. It could be a number of different things that qualify under the HSA rules. And I'm happy, by the way, to send you the HSA rules if you will email me at neil@thewealthcreatorcompany.com, neil@thewealthcreatorcompany.com. Spell it all out, and I'll send you that list, that link, or the list itself. But again, you can accumulate. The FSA, the flexible savings account, on the other hand, does not give you that ability. So when you have an FSA at work, and sometimes, by the way, at work, you have the choice of an FSA and or an HSA. But the FSA, the flexible savings account, does not provide for rollovers. So if you don't use all of the money that you have put in there, by the end of the year, you lose it. So do not put too much money into the FSA account, and if you do, find a way to spend it before December 31. Otherwise you will lose it. That is not a good thing. Again, you do not have to do that with the HSA, the health savings account, and that is one way to take care of those expenses that are associated with your deductible or with your co-payments. And typically you will get a debit card with the account. The account can be opened at various places, maybe even your bank does it, but there are certainly places that you can get an HSA account. Some of the insurance companies will in fact help you to set them up through their affiliations with financial institutions. But if you need something on an independent basis, again, let me know. Neil@thewealthcreatorcompany.com, and I will certainly send you the list of the institutions that my clients use, that I recommend my clients use, and it can be done at an independent institution in several places in the United States. So the other part of the program that we're under now, of course, the ACA, the Affordable Care Act, commonly known as Obamacare, is the ability for you to get help. So if you have a certain amount of income, if your income is under a certain level, then you can get subsidies. And this is important. And by the way, not every agent does this. Not that you have to use an agent, but I would highly recommend it. But be patient. And I say this with much respect. If these folks out there that are handling health insurance are helping you, be patient. They are completely overwhelmed. The rules that apply to the ACA are ridiculous. They've had to go through special certification process in order to be able to handle the subsidized plans, they are getting paid less than they've ever been paid before in order to help you. So please be patient, because it's difficult. They're dealing with dozens and in some cases hundreds of people who have to go through this process in a very short period of time relatively. You don't have all year to do this. You have a few months, couple of months, and you got to get it done. So please be as patient as you can and realize that they're doing their best given the circumstances. Not all questions can be answered immediately. In fact, in some cases, questions can't be answered at all. They go to sources and they cannot find the answer. They go to different places, they get different answers to the same question. This is why I'm saying that the medical insurance situation currently is a bloody mess. It is very, very difficult, and that's not to make excuses for agents. I am just telling you they are up against a wall in many situations. So be patient. The other part of it is, and for those people who are going through certain life circumstances during the year, that also enables you to make changes to your coverages. If you're going through a divorce, if you've had a death and so forth, those are extenuating circumstances during which you can make changes outside of the normal annual change period. So be aware of that in the event that you do go through something in 2017, or you're expecting to go through something in 2017. You will have, I guess unfortunately, you will have another opportunity to take a look at your health insurance and make some changes. For those of you who are employed and you're looking at the health insurance opportunities there, also keep in mind that you're probably looking at other things like long-term care, long-term disability, life insurance, dental care, and so forth. And for those of you who are on Medicare, I know that my father and other people have told me that they've decided, out of heck with it, I'm just going to go to Kaiser. And I know that there are people out there that think, you know, Kaiser kills people. It's not been my experience. I found them to be fine. So they're going to Kaiser. They're not paying anything for their Medicare supplement. Their whole Medicare package is all wrapped into the Kaiser system. And for an extra $20, $30 a month, whatever it is, they can get dental and vision. And it seems to be pretty good. So that's also an opportunity that is available to you. So, look, I could go on with this, of course. This is a complex, complicated, and real pain in the neck for most people to handle. And I'm happy to help you in any way that I can. And I'm happy to introduce you to the people that I work with that handle these areas for me and for my clients. This is not something that I handle directly, but it is something that I'm involved in indirectly with many of my clients, just to look at all of the options because they can be so overwhelming. It's just the way that it is. I don't mean to sound too negative about the mess that we're in that regard, but unfortunately it is something that we have to deal with, and we do have to have some kind of health insurance given the fact that you know, we got to go to the doctor, we got to go to hospitals, and unfortunately, as they say, shit happens. So you got to be protected. If there's anything else I can do, and I know this was a very general overview of what's going on, and there's not a lot that can be said, quite frankly, in detail in 10 or 15 minutes, but I'm happy to chat with you some more and help you in any way that I can. Feel free to email me, neil@thewealthcreatorcompany.com. You can also call me directly. Call or text me. Here's my phone number, 818-606-7327. That is my direct line. It is my only number, my one and only number, and I'm happy to take calls, texts, and help you in any way that I can using that method of communication. In the meantime, feel free to go to neilsdeals.com and take a look around, neilsdeals.com. If you're going through a divorce, or, you know, you've gone through a divorce, or you're thinking about going through a divorce, you can also go to one of my other websites, which is www.thedivorcetransitionprofessionals.com, www.thedivorcetransitionprofessionals.com, and take a look around there. There's some good information, good people to talk to. This is Neil Palache with the Wealth Creator Company for Women. It is Monday afternoon, 5:15 p.m. Pacific time on the west coast of the United States. I wish you all a great week and a great October and a great fourth quarter to 2016. Take care. Neil Palache signing off. Thanks.